Hi, I am Tuğba Çelen Yoldaş. I'm a developmental behavioral pediatrician from Turkey. I am delighted to share with you our new study about developmental and behavioral problems of preschool children with chronic rheumatic diseases. This study was conducted by the Departments of Developmental Pediatrics and Pediatric Rheumatology at University of Health Sciences Sarmolu Children's Hospital. Chronic health conditions have a significant impact on children and their families. Children suffering from chronic health conditions must overcome both the illness itself and its influence on their developmental and behavioral functions. Distress experienced by parents can disturb family functioning and further influence the overall adjustment of the child. Juvenile idiopathic arthritis (GIA) is the most common autoimmune chronic rheumatic disease in childhood. GIA can cause many disabilities with varying disease courses. Familial Mediterranean fever (FMF) is the most common and best understood autoinflammatory disease. It is characterized by self-limited recurrent febrile and serositis attacks. We aimed firstly to identify developmental and behavioral problems of preschool-age children with common chronic rheumatic diseases, secondly to compare the diagnostic categories, and thirdly to illustrate the associated factors with these difficulties. The general development and behavioral problems of each child were evaluated by the Ages and Stages Questionnaire (ASQ) and Child Behavior Checklist (CBCA). The State and Trait Anxiety Inventory and Back Depression Inventory were used for maternal well-being. Of the 91 participants included in the study, 46 were children with rheumatic diseases and 45 were healthy children. The percentage of children who failed at least one domain of the ASQ was higher in children with chronic rheumatic diseases than in healthy children. Delays in fine motor and problem-solving domains were higher in children with chronic rheumatic diseases than in healthy children. According to the diagnostic categories, the percentage of children with a delay in fine motor was the highest in GIA. In the model of logistic regression analysis, being in the group of rheumatic diseases, fewer maternal education years and higher total screen time in a day were found to be independent risk factors associated with any developmental delay. Behavioral scores of the participants on the CBCA revealed more internalizing problems in children with chronic rheumatic diseases than in healthy children, despite there being no difference between the diagnostic categories. Externalizing and total scores were positively associated with total screen time in children with rheumatic diseases. Maternal trait anxiety scores were positively associated with internalizing and total problems only in children with FMF. Based upon the considerable effects of chronic rheumatic diseases on developmental and behavioral trajectories of children, we have identified some difficulties of preschool-age children with a diagnosis of GIA or FMF. We were also able to see a comparison of these problems in children with an autoimmune and autoinflammatory condition. The early years are important to understand the complex interaction among the characteristics of the disease itself and biopsychosocial factors, as well as the reciprocal effects of development and behavior on disease and the environment. Preschool children with a diagnosis of chronic rheumatic diseases were more vulnerable in terms of developmental and behavioral problems compared with healthy children. Therefore, we believe that the management of chronic rheumatic diseases in the early years should include the screening of these problems by providing medical treatment with a multidimensional approach. Thank you for your listening. I also want to thank my colleagues for their contributions and the families participating in the study.